All right, so we're accessing cranial nerves today. We're going to start off with cranial nerve number 5, which is the trigeminal nerve, and it's going to be assessed by sensation. So I probably should have gloves on for this, but my wife says okay. So sensation across the forehead, cheek. Did you feel that? Mm-hmm. Okay, awesome. All right, so the next cranial nerve is going to be cranial nerve number 7. It's going to be the facial nerve, and we're going to do this. We're going to assess it by you puffing out your cheeks and smiling at the same time. So I don't know if I look at there, puff your cheeks out, smile. Perfection. Okay, now we're going to do cranial nerve number 3, 4, and 6, and that's going to be the oculomotor, trochlear, and the abducens nerve. The way we're going to do that is this pen right here. We're going to do the 6 cardinal gazes. So follow the tip of my pen. All right, so the next thing we're going to do is we're going to assess cranial nerve number 2, which is the optic nerve. And I'm going to ask you what your Snellen chart result was.
My Snellen chart was 2020.
2020? Perfection. All right. The next one's going to be cranial nerve number 8. It's going to be the vestibulocochlear. Can't pronounce that. But we're going to do that is we're going to assess it by the whisper test. I'm going to whisper something in your ears, and you're just going to repeat it, okay? All right.
Basketball.
Basketball's right. We're going to check the other ear.
Soccer.
Soccer was correct. So basketball and soccer, both ears are functioning fine. Now we're going to do optic nerve number 1. It's going to be the olfactory, and actually we're going to test that by smell. So I'm going to have you close your eyes and guess the smell, all right?
Mint.
Mint? Mm-hmm. That's close enough. It's mint gum, so we're going to rock with that. Now it's going to be cranial nerve number 9 and 10. 10 and 9. It's going to be 10, which is the vagus, and 9, which is the glossopharyngeal. And that's going to be, I'm going to have you open your mouth and say ah.
Ah.
Perfect. All right, now I'm going to close your mouth and swallow. Perfection. Okay, now the next thing we're going to do is cranial nerve number 12, which is the hypoglossal. And the way we're going to do that is by having you stick out your tongue. All right, and I think you put your tongue back in and smile. Perfection. You're doing great. All right, now it's going to be cranial nerve number 11, which is going to be the accessory nerve. And all I'm going to have you do is just shrug your shoulders. Perfect. All right, and that's the cranial nerves.